Here's what healthcare spend is like in other countries. In the UK, the total healthcare spend per capita amounts to just over 4,000 Rand per month. While in India, the total healthcare spend is vastly different, coming in at just over 70 Rand per capita per month. In comparison, South Africa is somewhere in between. From a general economic perspective, South Africa has a population of nearly 56 million people, an annual GDP of 4.1 trillion Rand, and a monthly GDP per capita in excess of 6,000 Rand. The total healthcare spend for South Africa is equal to 8.5% of the GDP, amounting to just over 348 billion Rand. Our total healthcare spend therefore comes in at 522 Rand per capita per month. South Africa uses two healthcare systems: public healthcare, which spans 4.1% of the GDP, and private healthcare, which spans 4.4% of the GDP. 84% of the population currently uses the public healthcare system, which makes the average monthly healthcare spend about 300 Rand per person. 16% of the population uses private healthcare, making the average monthly healthcare spend 1,690 Rand per person. JLT South Africa agrees with the government that this needs to change. Through National Health Insurance, the government aims to provide universal healthcare to all South Africans by 2026. What would happen if all South Africans were to have 1,690 Rand available monthly for healthcare? In 2017, the SARS tax collection amounted to 1.2 trillion Rand. Therefore, SARS would need an additional 779 billion Rand to fund the new healthcare spend. The only way this can be achieved is to increase tax by 65%. We don't believe that a 65% increase in tax is a realistic solution to providing universal healthcare to all South Africans. As a leading global specialist employee benefits broker and consultant, we believe that the scale between private and public healthcare needs to be more balanced. So how can JLT help? Funding and resources become available in the public system should the 10+ million employed people relying on this system become insured through private means. We propose private primary care cover for these employed people at approximately 300 Rand per person per month, which will add an additional 3.4 billion Rand per month into the total healthcare spend of South Africa. The spend per capita in the public system will therefore increase to 397 Rand per month due to the decreased population now dependent on the public facilities. If we work together, JLT can, with the help of our clients, the employers and employees of South Africa, make a positive difference in our healthcare system. We all have a part to play in our South Africa, and this is ours.